Thank you very much for joining us again, Dr. Nagpaul. We really enjoyed talking to you last time, but now so much time has elapsed, more than 6 months since the virus hit the world. And we've learned a lot and changed our minds about a lot of things, right? Now, the point that is most worrying is that while everybody thought, particularly in England and Europe, that we're over it, now we're going through second spikes and third spikes. Why is this happening? And really, what can be done about it? And if India goes through a similar thing with a bit of a delay, like we did earlier, what can we learn from it?
One thing we have learned is that this is a virus that is still highly infectious. It's the same virus that created the first spike. And in the UK, we brought down the infection after the first spike. We brought it down to about 500 new cases every day in the middle of July. Today, now, we have over 7,000 new cases every day. That's, a huge 12-fold, 15-fold increase. So what this proves is that one can never slow down the determined effort that every nation needs to make to control spread. This infection will just keep coming back the minute you take your foot off the pedal. And what we, I think, have recognized is that we have to learn to adapt society to bring down this infection on an ongoing basis. What we've had to do in the UK is, of course, reopen some normal functioning in life after the lockdown. The lockdown was quite extreme. It lasted 3 months when people were literally staying at home for those 3 months. We've now reopened shops and workplaces and so forth. Schools have reopened, as have universities just now. What we found is that the infection is now spreading quite fast, and measures are now being put in place by the government to control spread whilst we continue to allow society to function in a modified manner. And I think that's what the message is. It's a new normal. We can't go back to the way we lived before. We have to find different ways of living, different ways of interacting. We have rules around how many households can meet indoors, outdoors. We have compulsory wearing of face masks now. That was rather a late regulation. I wish that had been done earlier, but now we do have regulations which are mandatory. We have fines for people who don't adhere to those regulations. There are clear rules around how restaurants, workplaces should operate. I have to say, I think the important point there is whether workplaces can adhere to those rules, because they were never designed to accommodate people working 2 meters apart, for example. So they need to have extra costs to have barriers in place and adjustments so people can be kept apart. So there's quite a huge challenge. And I just want to say, not just the UK, but even the rest of Europe, we are seeing the infection bouncing back and creating all sorts of difficulties because it's spreading.
That was very interesting, Dr. Nagpaul. Now for the million, or should I say the billion-dollar question about the vaccine. We've got so many different organizations trying to develop a vaccine, and they're all promising it's about to come, it's about to come. We saw that Oxford had really developed, they had a bit of a setback, but they've got over that. When will this vaccine be ready for use in the wider public? And not only ready, how long will it take for it to be distributed to really billions of people worldwide? What are we looking at? Is it okay to say, let's all just relax, the vaccine's coming and that'll solve everything?
Well, the whole world and the medical profession across the globe wants to see a vaccine developed as soon as possible. The problem with any vaccine development is that you can't be sure of its safety until all the trials and safety checks have been done, and a hiccup can occur even at the last stage. Our understanding is that it's very unlikely to occur to be ready for the public until early next year, and even that could be delayed if there are any hiccups last stage, if, for example, an important side effect comes to light. So the priority now is, I believe, to control the spread of the infection in the here and now, make sure we have measures in place to prevent the virus spreading from person to person, but also to match that with a competent and agile and responsive test and trace system. The two need to be going hand in hand now. No one should be complacent thinking that, let's wait for the vaccine. We all want that vaccine to be here tomorrow, but we know it won't be ready for a few months. So there should be no slowing down in the efforts to control spread. Because remember, this virus, does lead to very serious ill health. In the UK, we are going into winter. And as a doctor, one of the real concerns we have as a medical profession is we don't want to go back to the scenes in April and May, when in fact, our hospitals were completely taken over by COVID patients, and we couldn't provide care to non-COVID patients who suffered significantly in the lockdown period. So the efforts must be to control spread now.
Thank you very, very much for joining us, Dr. Chaand Nagpaul. Very interesting, and I wish you luck as England's going through this tough time right now. We must learn from all the things that you have understood by trial and error and by science. Thank you very much.
Thank you, Dr. Rai. Cheers.